Okay, so today we'll continue with our 10th lecture from the behavioral science course. So far, we have covered mostly philosophical and psychological topics. We talked about philosophy in ethics, and we have covered grounds in psychology when it comes to developmental psychology, some basic psychological theories when it comes to learning, and also some psychological tests. Today we're going to delve into a new behavioral science, which is sociology, and how it relates to U.S. physicians. So today we will cover family, culture, and illness. So psychology is the study of mostly individual behavior, whereas sociology is the study of societies. Now the difference between psychology and sociology may not be all that clear, because there's also what's called social psychology, and that is how people behave when they're in groups. So it's sort of the middle ground between psychology and sociology. But today we'll discuss how family, culture, and illness relates to the medical profession. You as doctors have to understand that there are various cultural and social differences according to the patients and the groups they belong to. And you have to be ready to encounter different cultural and social groups, and also how they relate to their family. And maybe their way of organizing families is different from what you're used to. But this is crucial because in the medical profession, remember that many of these topics are about the doctor-patient relationship. I mean, how do you make sure that the patient complies? And in order to do all of this, well, you have to make sure that you build a strong doctor-patient relationship. And most of the time, the patient's relatives will probably be your allies when it comes to this. So you have to make sure that you understand, what are the basic sociological approaches to family life and also to culture. I mean, if a patient is from a different culture as the doctor, then there may be some adjustments that are necessary to make. So we'll cover some of those topics over here in this lecture. Remember that all of these topics are to be included in the USMLE Step 1. So at the end of this lecture, we'll do some review questions covering the topics that we talked about in this lecture. Okay, so let's begin with the first topic, and that is family. Well, how do we find a family? A family is a group of people that are related by blood, adoption, or marriage. So there are different types of family, and we'll get to them shortly. But for now, it suffices to know that, well, a family is a group of people related by blood, adoption, or marriage. So just because some people come together, like let's say a fraternity, well, a fraternity is not strictly a family, although it may come to that because the only, not necessarily being related by blood is the only way of forming a family. Now, evolutionary psychologists have a lot of discussion about whether or not blood bonds between people are stronger than other types of bonds. So, as you've probably seen in movies or read in books or seen many cultural depictions, people have always wondered whether or not blood is thicker than water. Now, of course, this is a metaphor. I mean, we're not talking here about the chemical properties of those two substances, but we're actually talking about whether or not those people that are related to blood tend to have stronger bonds amongst them. And evolutionary psychologists have told us for many years that yes, that blood is indeed thicker than water. And this goes back to a very important concept in evolutionary psychology that's called kin selection. Now, in kin selection, organisms behave altruistic towards those other organisms with whom they share some proportion of genes. Because in evolutionary theory, altruism has always been a little bit of a mystery. I mean, if we're in a struggle for existence, as Darwin claimed, then how come that some animals sacrifice themselves or behave altruistic for the sake of others? Well, it all makes sense if and only if, according to evolutionary psychologists, those organisms that are receiving our altruistic behavior are also related to us. Because by doing so, we make sure that they are able to pass their genes to the next generation by, sacrificing ourselves for them to live. And if they're able to pass their genes to the next generation, then that increases the probability that that very altruistic gene is also passed to the next generation. Now, that preference to favor or to be altruistic towards people that are related to us genetically, that in evolutionary psychology is called kin selection. And there was a very famous evolutionary psychologist, or actually he wasn't really an evolutionary psychologist, he was a biologist. His name was William Hamilton, who formulated some mathematical formulas explaining in mathematical terms how exactly kin selection works. Now, we won't get into that, but for now it suffices to know that the kin selection is a very important concept in evolutionary psychology, and that it attempts to explain behavior, and I think it explains behavior pretty well, and that there is a tendency amongst human beings, and not only amongst human beings, amongst all organisms, but especially in animals, to behave altruistically to people who share, with whom we share genes. So you can expect someone to be more kind to their brothers, and to be more kind to their brothers than to their cousins, but at the same time to be more kind to their cousins than to their neighbors, and at the same time to be more kind to their neighbors than to complete strangers. Because the odds are that the more altruistic you are towards someone, the greater the genetic similarity will be, or the greater proportion of genes there will be. And this is the basis of nepotism. Nepotism is the tendency that we all have to favor people with whom we are related. Now, of course, you may tell me that there have been people who are very altruistic towards others and they're not related to them. And, well, it's because altruism is, according to evolutionary psychologists, is not just about kin selection. It could also be with the expectation of reciprocity. So we're good to other people, expecting other people to be good to us. But even aside from that, it could also be that adoption, to a certain extent, substitutes blood relations. Now, it has been documented by many evolutionary psychologists that adoption solidarity is never as strong as a real blood solidarity. So there is a tendency for parents to love their kids or to care more for their kids if they're related to them by blood than if they are adopted. And in evolutionary psychology, there is a phenomenon that I think physicians should be aware of, and that's called the Cinderella effect. We've talked about this in the past, and that is that there is a greater chance of child abuse if the child is adopted than if he's actually living with his biological parents. Well, that may have to do, again, with the fact that being related to other people increases our probability of being altruistic towards them. So, at any rate, I mean, that's some important information there from evolutionary psychologists. Now, for you physicians, it is important to understand that interpersonal relationships in families play a significant role in the health of family members. In previous lectures, we have talked about how not in all diseases, but in many diseases, in many illnesses, married patients have better prognosis than celibate patients. And this is because health, to a large extent, depends on family support and how patients relate to their relatives. So interpersonal relationships in families play a significant role in the health of family members. If you're going through a disease process, but you have good support from your relatives, then I think that increases your chances of making either a partial or full recovery. So this is why it's so important for the doctor to be aware what's the family network of the patient, because depending on how strong that family network is, the patient may have a better or worse prognosis, and also because the doctor needs to take into account that those family members are his allies. So if you are going to try to implement any program, or you're going to seek some behavioral change from the patient, well, you probably also need to get the relatives involved, Although remember, confidentiality always requires consent from the patient in order to do this. But if the patient consents, then it's very important for the physician to get involved, the family members, because family support has definitely some important influence on the health processes of patients. So let's consider some of the types of family that you're likely to encounter in your medical practice. Now, it would be natural for all of us to assume that everybody has the same type of family, but anthropologists have told us that no, that's not the case, and that there are different types of family across different cultures. Now, you're probably most used to the traditional nuclear family, and that is the family that is made up by the mother, the father, and the dependent children living together. And that's the type of family that is most likely encountered in urban societies or industrialized societies such as the United States. In Latin America, it's becoming increasingly more common, but it's not as common as in more industrialized societies. And these are for complex sociological reasons. In the countryside, there's more space, and the nature of work and labor allows for people to live together in greater families. Whereas in cities, space is not so big, so apartments are smaller. So in small apartments, not everybody fits in an apartment. So apartments are more compartmentalized in nuclear families. And also the nature of work usually requires a lot of mobility. So some people have to travel to other destinations in order to perform their special labor over there. So the whole family can just move. So the person can only take his wife and his kids. That's why I'm saying that industrial lifestyles and urban lifestyles usually go more hand in hand with nuclear family than with other types of family. Now, apart from the nuclear family, there is also the extended family, and this is usually made up of grandparents, uncles, aunts, cousins, etc. And as I was saying, this is more common in rural societies. So U.S. doctors can expect patients coming from urban settings, let's say the American middle class or American white middle class. It's more likely that the patient will be inscribed in a nuclear family, whereas if you have patients from other cultures, well, the chances that they live with an extended family are greater. Now, the traditional nuclear family and the extended family are not the only ways of organizing kin or family relations. There are also other kin units. For instance, anthropologists have talked about lineages, and lineages are a group of people who claim descent from one specific ancestor. This is more common this used to be more common in feudal societies. So, for instance, someone would begin to the lineage of, let's say, the Bourbons in Europe or the Habsburgs. Well, those were aristocratic families, and all the descendants claimed to be descendants from one common ancestor. They can also be clans, usually clans as opposed to lineages, although this is not necessarily always the case, but usually clans, the ancestor is more mythological. So for the most part, clans have an animal symbolism. So there's people who claim to be descendants of the cow or of a horse or of a mythical character in the past. So this is another kin unit that's frequently encountered. Now, in urban societies, this is not so common because urban societies are not structured so much around families, but rather more around labor relationships and other forms of social groupings. But in rural societies, it's different. I mean, kinship is much more important in rural or pre-modern societies than in urban modern societies. So if you go to New York City, I don't think a lot of people will care too much about what clan they may have belonged to. But if you go to the Scottish Highlands, for instance, or if you go to places in India or in Africa or even in Latin America, well, there is a greater probability that you will find clans as social and kin units over there. And maybe some of those clans will also be represented by animals. That's also called totemism or totems in the anthropological jargon. Now, some of these key units may be patrilineal. Patrilineal units are the ones that people claim descent from the paternal line. That is to say that the membership of a given group is inherited via the father, or it could be matrilineal. That is to say that the membership of a given group is inherited via the mother. Or it could also be bilateral, or as it is known, cognatic. Now, in most industrial societies, again, the line of descent tends to be more cognatic or bilateral. I mean, we give pretty much the same importance to our mother's relatives as to our father's relatives. But in some societies, this is not strictly like that. In some societies, for instance, in patrilineal societies, people do not engage much in relationship with the parent or with their relatives from the mother's side. And in matrilineal societies, people don't engage much with relatives from the father's side. Now, obviously, modernity has been changing this, and but there are still remnants of the past. So, for instance, I was in the Marshall Islands a few months ago, living there, and there it's pretty much a matrilineal society. So over there, the kids they wouldn't really care about their paternal grandparents, but they would give a lot of importance to their maternal grandparents. But as I was saying, as society modernizes and becomes more urban, well, kinship tends to be more cognatic or bilateral. Okay, so along with differences in family, there are also differences in marriage, and there are various types of marriages. Over here in our urban, industrialized Western society, we're more used to monogamy, and that is the pairing of one man and one woman. But again, you're likely to encounter people that do not follow this marriage pattern. So apart from monogamy, there is also polygamy. Now, an easy way to remember this is that mono, it means one, and gamos means marriage. Polygamy, it means many. So polygamy is a multiple marriage. And there are various types of polygamy. First of all, there is a polyandry. This is very rare. And this is when one woman marries many husbands. This is only found, probably the most famous cases of polyandry are found in India. But it's not very common. Much more common is polygyny, and this is one man married to many wives. In the United States, for instance, for some years, Mormons were polygynous, and to this day there are some sects of the Mormon Church that that practice polygamy, and that one man is married to many wives. Now, it's important for you to know, especially if you do some of your rotations in Utah or some other areas that are strongholds of Mormons, that the Mormon Church, or as it is usually, as it's officially known, the Latter-day the LSD Church, the Latter-day Saints Church of Jesus Christ, LDS. I'm sorry, not LSD. LDS, Latter-day Saints of Jesus Christ. That's the official name of the Mormon Church. That church is no longer it no longer allows for polygamy, but there are some sects that have broken with the official Mormon Church, and they have organized their own little churches where they allowed polygamy. Now, under the law, polygamy is not allowed in the United States, but they still practice it nevertheless. And it's not really a felony because it's not really a marriage, but it's rather more of an amorous relationship. It's not really a felony unless minors are involved. And when there have been some high-profile cases of polygamous Mormons, it's usually because there are some minors involved, and of course that's breaking the law. Now, apart from Mormons, you are very likely to encounter in your practice, in your medical practice, in rotations in the United States, you're likely to encounter Muslims. And again, even though polygamy is not allowed in the United States, it's not legal, it is likely that you will have some patients that will come from either Middle Eastern or Asian countries, that is to say Muslim countries. And in Islam, well, it is allowed for one man to have 4 wives. Now we can have all sorts of arguments about whether or not this is ethical and whether or not polygamy is a good or a bad thing. But it's important to overcome some of the stereotypes. Now, just because a man is married to more than one woman, that doesn't necessarily mean that the women have lead terrible lives. Again, we may discuss whether or not this is ethical and whether or not this diminishes women, but the fact is that you're very likely to encounter it, and well, that you have to work with that. Apart from that, there are also group marriages. This is very rare. It's extremely rare, but some anthropologists have found some examples of group marriage. That's when a group of people marry another group of people, and they exchange. They're kind of like swingers, but with the difference that they're actually married. So I mean, they don't just get together for sexual purposes. They also get together for family life, and they're committed to being married to multiple people. Anthropologists once in the 19th century they argued that this was quite common during the first phases of human existence, and that this may actually be found in some Pacific Islanders culture. But today anthropologists are not so sure that group marriage ever existed, and today no group marriages really exist as such. There may be some hippie communes and other things like that, but they're usually social experiments that don't last for very long. And apart from group marriage, well, there's also another division that we can make when it comes to types of marriage, and that is a heterosexual and homosexual marriage. Again, we may discuss whether or not this is moral, whether or not this is ethical, but the fact is that an increasing number of countries are accepting it, and that gay people who get married, they don't seem to be suffering a lot. So U.S. doctors need to understand that this is becoming a reality, and that you are likely to encounter patients whose family support, if it is a man, well, it's most likely to be another man, and you have to work with that in order to build a strong doctor-patient relationship. So let's talk about some of the demographic trends in the United States. And we're talking here about the United States, well, because of the rotations that you will most likely be doing as medical students in American hospitals. So in the United States, the usual age of marriage is 25 for women and 27 for men. Now this varies a little bit according to locations. In cities, people tend to get married a little bit later because they want to have more job opportunities. So they decide not to settle down yet because there are increasing chances that they may have to move somewhere else, or that they are waiting for a promotion and so on. Whereas in the countryside, life is a little bit more stable, so it's different. And in America, this is not becoming so much a big problem, but in Europe, the age of marriage is increasingly dramatic. Is increasing dramatically, I'm sorry, and of course that affects fertility rates, because of course the older you are when you get married and you plan to have children, where the lesser the probability that you may expand your fertility window to the fullest. So in America, so far this is not such a big problem, but it's something that the future planners of the American society will have to be concerned with. And it's actually quite the opposite from, for instance, from sub-Saharan Africa or Latin America, where the marriage age is far, far younger. And of course, this also presents problems, because in Europe there is a problem that people don't want to have children, and that they marry when they're too old. In Latin America or sub-Saharan Africa, it's the other way around. It's the opposite. I mean, people marry too young. And there's a lot of unplanned pregnancies, so this also becomes a problem that ultimately leads to underdevelopment. In the United States, about 40% of children live with two parents, and this has been some reason of concern for some politicians and some sociologists, especially among some ethnic minorities, and I'm thinking especially about the African American community. There is a debate amongst African Americans, and also about people that are not African Americans but that have some opinions about African Americans, about why why have African Americans had some problems in the past? Now, obviously, they have been victims of racism, slavery, and segregation, and of course, that's all true. But there are some other academics that say, well, but that's not the whole story. The fact that there are single parents homes, that the rate of single parents homes among African Americans is very high, well, that fact also leads to some of the problems that are encountered in the African American communities. And of course, you see that the African American population in the United States is about 12% of the whole population, but about 80% of African Americans are in prisons. So why does that happen? Well, some people may claim that it's because of racism, and there is a lot of truth to that, but it may also be that it's because the family is not as strong in African American culture as it used to be in the past, or as it is now being compared to other groups that do not have the problem of single parenthood as acutely as African Americans have them. So overall, 40% of children live with two parents in the United States. 60% live with just one parent or with no parent at all, and that could be a something of a concern. 23% of children in the United States live in the traditional family, or quote-unquote traditional family, and that's when the mother is not working. And feminists have always said that, well, this shouldn't be like that, because women should go out and work as much as men, and they should have the same labor opportunities. And this is a big debate. I'm not going to take sides with this here, but I think it's important to know two things. First of all, well, it is true that when women stay home, they may become more powerless, and when they go out and work, they may become more empowered. But on the other hand, it is also a fact that raising a child, the child will get greater benefits if the mother stays home, because the mother will pay more attention to the child. So really, I mean, those are two variables that that people have to balance, and they have to decide on what's best for them. Now, the other thing that I also think that should be kept in mind here is that, look, whatever is good for the woman, and feminists may argue either one way or the other, what's important here is not to push it, and ultimately let women themselves have the ultimate decision. If a woman wants to go out and work, well, she should be allowed to. And if a woman does not want to go out and work, and she wants to stay home and raise the children, I don't think husbands should really push them, or other feminists should really push wives to go out and work. It should be ultimately up to them, and everyone else should respect their own decision. Divorce, that's another important topic when it comes to the sociology of family. In the United States, it's about 50%. This is another alarming number for a lot of people. So apart from broken families and single-parent homes, there's also the problem of divorce. There are many factors associated with divorce. First of all, short courtship, lack of family support, premarital pregnancy, marriage during teenage years. Of course, if you're not mature enough to handle this, marriage is difficult, I can tell you. Divorce in the family, so if you come from divorced parents, you're more likely to be divorced yourself. Differences in religion or socioeconomic background. Yeah, it's tough for a Catholic to marry a Muslim or vice versa, and to hold that marriage together for a long time. There are some people that have been able to do it, and it's good for them, but it is a fact that differences in religion or socioeconomic background do cause some disparities that may ultimately lead to divorce. Also, insecure financial status and serious illness or the death of a child. If you ever watch Gone with the Wind, which is a classical movie, one of the last scenes of that great movie is when the kid of the couple, who are the main characters, dies because she falls from a horse. And it ultimately comes down that that couple, they get divorced because they don't have the kid with them anymore. So they go each their own separate ways, and it's quite a tragic story. But it is a fact that when a couple loses a child, especially if it's the only child, that increases the risk of divorce. Divorced men are more likely to remarry, not only because they have a greater fertility window, but it's also because they're more empowered. So they're still in the market, whereas for women it's a little bit more difficult. And I think that it's also important that it's also important to know that U.S. physicians are at a greater risk of getting a divorce due to all the stress that you go through in your profession. So you have been warned about this, and it's an important fact that you must keep in mind. And if you decide to get married later on, or if you are already married, well, you need to be aware that you are at a higher risk and that you need to do something about it in order to prevent this from happening. So as I was telling you, marriage or being married has important consequences on health. So let's talk a little bit about marriage and health. Good marriage is a predictor of mental and physical health. So patients who are married, they have usually better prognosis than patients who are not married, well, because of all the family support that's necessary in the healing processes. And you need to understand, again, that U.S. doctors, when you develop the doctor-patient relationship, the spouse and their relatives are your strong allies when it comes to getting the patient to comply with treatment and to lead a change in their lifestyle and behavior. We've already talked about some of the factors associated with the risk of divorce. We can also talk here about some factors in marriage stability. So first of all, intimacy and commitment. Couples that share activities, that do things together, and that they're committed to each other, they have a stronger probability of not getting divorced and having a more stable marriage. Other factors important here are strong communication, the ability to manage conflict constructively. So, I mean, look, sooner or later, and I can tell you this because I have been married for almost 10 years, sooner or later you're going to fight with your wife or your husband. But what's really important here is to communicate with others. And if there is infidelity can be worked. Trust me, it's not the end of the world. But you can work it out if you talk to your spouse. And also, you have to be aware that there will be problems, but what's important here is to manage it and manage it constructively. So, I mean, if you want to ensure that your marriage stays stable, you can face the problems. This is not a fantasy. I mean, problems will come, and it's inevitable. But the thing is, what's really important is how you handle those problems and how you manage them constructively. And also other factors are shared experiences and values. So that's why it's important for couples to do things together, to compenetrate each other. And also high levels of warmth and affection. So hugging, kissing, having sex, being kind to each other, all of that are really, and even having details. I'm not a person that gives a lot of details to his wife. I mean, I don't buy flowers or chocolates or any of that stuff. But I think, and that doesn't necessarily have to be that way, but that certainly helps in the relationships as long as it provides a warmth and affection. So as long as the other person, as long as the spouse feels loved and cared for and compenetrated, then you are increasing the odds of having a stable marriage. And another factor is, well, financial stability. Yes, even if you love someone a lot, well, if there is financial instability, if there is not enough money, that will cause some stress, and that may put in risk your marriage. So unfortunately, the money does matter, and it is a risk factor. So financial stability is another predictor of a good marriage, and also positive ties to the extended family. It's very difficult for you to hold a marriage together if you hate your parents-in-law or any of your other in-laws. And there have been many movies about this. You've probably seen some of them. Having good relationships with the relatives of your family, of your wife or your husband, especially in urban societies when, remember, relatives pay attention to both relatives on the mother side as well as on the father side. So that's why it's very important for marriages to succeed in urban and modern societies to keep positive ties to the extended family. Okay, another problem that we've already talked about in previous slides and that we're taking over here again is a single parenthood. So where does single parenthood appear in American society? Well, first of all, it's associated with lower incomes and less social support. It used to be thought that single parenthood was common amongst ethnic minorities, and to a certain extent that's still the case, and to lower social economic groups. But this is changing. So single parenthood is now increasing in educated professional women. 87% of single parent families are headed by women. So yeah, it's more likely that the father abandons the home than that the mother abandons the home. I mean, for every 100 single parent families, 87 are headed by the woman. That is to say that the woman remains with the children and she is in charge. Children in single parent families are at an increased risk for failure in school, depression, drug abuse, suicide, criminal activity, and divorce. I remember that when I was studying this stuff when I was in college, there was a famous book. I don't remember the name of the book right now or the author, but there was a famous book trying to argue that single parenthood in African American culture was not all that big of a problem because there were alternative ways of dealing with this. So maybe there is no daddy at home, but there are alternative male role models that can fill in the void. But most sociologists would not agree with this. Most sociologists would actually say that the children who grow up who grow up in homes that do not have a father or a mother, that is to say in single parent families, well, they are at increased risks for academic failure, for depression, for drug abuse, for getting into trouble, for suicide, and so on. So that's an important factor to keep in mind here. Now, even if it's a single parent home, if the father does not abandon the home altogether, but stays in touch with the kids, that decreases the risk of the kid coming from a single parent family home of getting into trouble or committing suicide or abusing drugs. So a contact with the parent, even if it doesn't have financial support, that decreases the risk of kids getting in trouble as a result of being raised in a single parent home. Okay, and what about gay parents? Well, this is a question that's in the forefront of sociological and psychological and ethical discussion. Are kids that are raised in homes with gay parents, are they at a greater risk? Well, research seems to show that gay parents are as competent as heterosexual parents. So some people who oppose gay adoption think that gay parents will not do a good job. But this is not what research seems to show. Research shows that gay parents are as competent as heterosexual parents. There's no correlation to child abuse. This is another myth. Some people claim that gay parents tend to abuse their children even more, and because there is some people who believe that homosexuality is related to pedophilia, but when we get to sexuality, we'll see that that has no basis whatsoever. So there's no correlation between gay parenthood and child abuse. There is a concern that if you have gay parents, you may be more bullied at school. But that's not the case so much in elementary school. It may be a greater risk in high school. But that's not enough to say that gay parenthood is a very destructive thing, or it's not a good idea. I mean, just because kids raised by gay parents are maybe bullied in high school, that's not enough of a reason to outlaw gay adoption. There's no additional risk of mental health in kids that are raised by gay parents. So, they are exposed to the same risks as everyone else. And there is no influence on sexual orientation of the child. One of the concerns that's usually presented by people who oppose gay adoption is that if gays adopt a kid, well, that increases the probability that that kid will also turn out to be gay. Well, that's not what the evidence shows. In fact, when we get to the topic of sexuality, we'll come to find out that being homosexual has a strong genetic component. So the fact that you are raised by gay parents does not seem to influence much on what your sexual tendency will be. Okay, there's also the topic of child custody. So there are various types of child custody in the United States. There is sole custody, and that's when the child lives with one parent while the other has visitation rights. There is joint residential custody. That's when the child spends some time living with each parent. And there is split custody. So each parent has a custody of at least one child. Especially those of you that are thinking of becoming pediatricians, this is important for you to know because, again, the development of kids or how they're raised by their parents and what type of family home they live in, that ultimately has some significant influences on their health and development of illnesses. So it's important for you to know all these facts. And let's talk a little bit about culture. In the United States, there are ethnic groups and there are also minority cultures. So for the most part, American culture is mostly white and middle class. I mean, that's the majority population. Now, the characteristics of a white American middle class is usually individualism, so they don't pay so much attention to group relationships or to family, but rather to individual thriving, self-reliance, and usually the elderly, they take care of their own. So that's why you see, especially in white America, nursing homes for the elderly. And if you go to a nursing home in America, you will see a much greater proportion of white people than people of any other ethnic groups. It's because in other ethnic groups, there is a greater tendency to take more care of the elderly, whereas in white middle class people, there is a stronger push for individualism and to not care so much about the elderly. There is a greater emphasis, or there's a very strong emphasis on personal hygiene, and this is very common in the white American class and the middle class, and the nuclear family is valued. The nuclear family is much more valued than the extended family or other types of family. We'll get to ethnic minorities in a bit, but in the United States. But before that, let's consider a little bit the relationship between culture and illnesses. Psychiatric illnesses are universal, but the normality of behavior varies culturally. And when we get to the DSM-5, we'll see that many of the disorders that are diagnosed in the DSM-5 always have a cultural reference. So there, in the diagnosis criteria, there is always, in most of those disorders, there is always the criteria that the symptoms should go beyond what's culturally expected. So if you live in a society where it is normal to hear voices because you communicate with the gods, then hearing voices should not be considered a criteria to diagnose schizophrenia, for example. So mental illness is in the DSM-5 is defined according to two basic criteria. First of all, that it causes distress, and second of all, that it's beyond the norms of the individual's culture. So that's why for those of you that are going into psychiatry, it is very important to know what the patient's culture is in order to make a right diagnosis. Now, mental illnesses are universal. So for instance, schizophrenia, it is a fact that schizophrenia is found in 1% of all cultures. And the same goes for mood disorders and for some other disorders. But there are also some culture-bound syndromes, and these are very specific psychiatric illnesses that are found in specific cultures and that are not found in other cultures. So there are a combination of psychiatric and somatic symptoms that are considered to be a recognizable disease only within a specific society or culture. So some of these culture-bound syndromes are recognized or identified in the DSM-5. For instance, one of them is ataque de nervios, and this is found in Latin America and in Hispanic communities in the United States. It's found nowhere else. And basically, these are the symptoms of this culture-bound syndrome is uncontrollable screaming or shouting, crying, trembling, sensations of heat, rising in the chest and head, or dissociative experiences, and verbal or physical aggression. So in Latin culture, this ataque de nervios syndrome is quite cultural, and there is even a famous movie about this. Mujer al borde de un ataque de nervios, a woman on the edge of having a ataque de nervios, and the director was Pedro Almodovar. It's quite a famous movie. In other areas of the world, there are other culture-bound syndromes. So, for instance, in India, you can find that syndrome. So, in this syndrome, patients report that they suffer from premature ejaculation or impotence, and they believe that they're passing semen in their urine. So this causes a lot of guilt and anxiety over masturbation. And this is related to the Hindu belief about vital fluids, and that 40 drops of blood creates 1 drop of semen. So when the people who suffer this syndrome, they have sex or they masturbate, they feel that they're wasting a lot of their body fluids, and they may grow very anxious over this. There are other culture syndromes that are not included in the DSM-5, but they are included in the ICD-10, which is another manual that is used to diagnose psychiatric illnesses. So, for instance, there is Koro. This is a culture-bound syndrome that is found in China, India, and Southeast Asia. And this is the overpowering belief that a person's genitals or the patient's genitals are retracting and they will disappear. So the penis is becoming smaller and smaller. And of course, people have this anxiety despite the lack of any true long-standing changes to the genitals. So the fear of shrinking penises in these countries is found much more commonly than in other countries, or than in other cultures, and that this is why it's called a culture-bound syndrome. So this culture-bound syndrome is called Koro. And of course, the cultural depiction of small penises in Asia, and you've probably seen this in TV and movies and other cultural depictions, well, that increases the epidemiology of this culture-bound syndrome in those areas of the world. Another culture-bound syndrome, amok. You probably heard the phrase running amok. Well, this phrase actually comes from this culture-bound syndrome that is found in Malaysia. It's a sudden, violent, and chaotic behavior. People all of a sudden people who have this syndrome all of a sudden begin running, and they may go into a indiscriminate homicidal fury. And this is where the phrase running amok comes from, because all of a sudden the patient may just start running, going around and trying to kill someone. This is usually considered to be a culture-bound syndrome found in Malaysia, but there could also be a cultural variant in America. So perhaps all those shooting sprees in America, such as the one in Columbine and the other ones that make the news, and usually, unfortunately, in America every year you find at least 2 or 3 cases of this each year. Well, perhaps those shooting sprees in America could be considered also a culture-bound syndrome that is not found in other countries of the world, and that may be relatively similar to amok.
You can see there are cultural varieties when it comes to psychiatric illnesses or mental disorders, and that there are some disorders that are specific to every culture. So it is very important for you to understand where the culture, what the culture of the patient is, in order to maybe make some diagnosis according to, perhaps the possibility of a culture-bound syndrome. Now, apart from that, you also need to keep in mind that there are different belief systems, and that they don't all understand mental illness in the same way that the rational, scientific Western medicine does. So this can pose some difficult situations for doctors, and you need to be able to learn how to cope with them. So this brings forth the difficult issue of mental illness and belief systems. So this has a strong relationship to compliance and response to treatment. Now remember, in the doctor-patient relationship, it's mostly about getting the patient to comply. And in order to make the patient comply, you have to make him your ally, and you have to be culturally sensitive to their understanding of the disease. So physicians must have respect for and work in the context of such beliefs in order to help patients. So if you have a patient, let's say, who is diagnosed with epilepsy and you assign them a drug treatment or a pharmacological treatment, but on top of that, they also believe that epilepsy is caused by either some spirit that comes in the body or some demon or something like that. And as a complement or as a supplement to the pharmacological treatment, they also want to perform some shamanic ritual or some exorcism. Well, I think you should tolerate that because remember, whatever helps the patient, as long as it doesn't interfere with the treatment, then you should find a way of accommodating to that. And this is a challenge of multiculturalism to medical practice, but you have to find a way to participate in this or to come around this. Now, that doesn't mean that you explicitly have to participate in the religious ritual. Remember when we talked about this in the doctor-patient relationship? You are required to respect, but you're not required to participate. But respecting the other culture is very important because, I mean, this is ultimately about is about the patient getting better. And if the patient is going to get better by giving value to his culture, then, you should go along with that. So, for instance, so physicians must have respect for and work in the context of such beliefs in order to help patients. For instance, if patients culturally think that some food will cure them, then doctors should try to provide them. And if patients believe in curses or similar stuff, then physicians should work with it. Again, you are not required to participate in this, but you are indeed required to respect it. Now, something similar to these cultural differences between patients and doctors, it's also the concept of culture shock. And culture shock is a strong emotional response, which may involve psychiatric symptoms that are related to the geographic relocation and the need to adapt to unfamiliar social and cultural surroundings. So this is very common, especially with young immigrant men who appear to be at a higher risk for culture shock because they must work and they lose status in their place of origin. So U.S. doctors need to be aware of this. You need to know that young immigrant men are a population that are at risk, especially if they're immigrants, and that this may eventually lead to some psychiatric complications. So culture shock is a sociological variable that you need to be aware of and that you need to work with. Okay, and for our last point, let's take a look at some of the minorities in the United States. And let's begin with African Americans. Well, African Americans are a group that has a lower income when it comes to comparison with other ethnic groups, although that's improving. But of course, having a black president, that's not enough to to say that African Americans have overcome all their difficulties. They have some psychiatric diseases and also some physiological diseases that are related to stress as a consequence of racism, and especially there is a surge of racism in the last years with all the police brutality cases. So this may have some impact on the health of African Americans. They have a lower access to healthcare, and so they visit doctors less frequently. So they have increased risks, and they also have some more unhealthy habits. All those stereotypical jokes about black people eating more in Kentucky Fried Chicken and so on, that may be a stereotype, and it's quite offensive, but nevertheless, there is some truth that the nutrition of African Americans, when it comes to cultural habits, needs more improvement than in any other ethnic groups. So this is a issue of concern, and doctors should try to work in African American communities in order to improve some of their eating habits. There is shorter life expectancy amongst African Americans. There are higher rates of hypertension, obesity, because this is related to the eating habits that I was referring to. There is more asthma, cancer, and AIDS. However, compared to other groups, they have a lower suicide rates, And this may be to the fact that their family and community networks are stronger than in other groups, although, as I said, there is a problem of single parenthood in African American communities. And it's also true that African Americans are more exposed to violence. 80% of the African American population, unfortunately, is in prison. I'm sorry, 80% of the prison population is African American. And of course, there are more impoverished neighborhoods and all of that. So unfortunately, they are more exposed to violence. It is true that African Americans suffer a great deal of racism, but it's also true that the greatest threat to them is not so much the brutality of white policemen, but actually of other African American men. So a black man is much more likely to be killed by another black man than by a white policeman. And unfortunately, these are difficult social problems that African Americans have to deal with, and that the doctors who treat African American patients, they also need to be aware of this. Let's talk about Hispanics. Very much as African Americans, Hispanics are strongly family oriented. They have a considerable respect for the elderly. That's very enshrined in Latin culture. So in nursing homes, you will not see elderly Latinos over there. As I told you, nursing homes are the overwhelming the overwhelming majority of people living in nursing homes are usually white middle class people. Because of the individualism and self-reliance, there is not the value of caring for the elderly in white middle-class culture is not as important as it is in African American or Hispanic culture. Hispanics also have folk medical beliefs, so they believe in the evil eye and herbal medicines and magical remedies and curses and shamanism and so on. So again, U.S. doctors, you need to work with this. It's no good telling a patient that the evil eye doesn't exist and that there are no curses, because maybe that may significantly impair the doctor-patient relationship. So you are not required to believe in this stuff, and if you ask me, you shouldn't believe in this stuff, but you should respect Hispanic patients when they tell you about the evil eye and the herbal medicines and so on. Asian Americans, out of all ethnic groups in the United States, Asian Americans are probably the ones that have the strongest respect for the elderly. There's the expectation in Asian American culture, mostly in Chinese culture, but also Korean and Japanese. There's the expectation that relatives must protect the elder from medical diagnosis and procedures. And this can be a problem because if they may come to think that the doctor is out to do some harm to the patient and that they can take care of the elderly patient better than the doctor, then that might interfere in medical treatment. So U.S. doctors need to be very sensitive about this, and you need to cope with it and you need to work it through. In some Asian American families, there is difficulty with the concept of brain death. Because they believe, or some of them, that the thorax, that is to say the area around the chest, is believed to be the core of the person. There were ancient beliefs that the center of thought wasn't really the brain but the heart, and some Asian groups believe this stuff. So that may also pose some difficulties. Remember when we talked about ethics, that really the criterion for death, at least in America, it is brain death. So that's when you're authorized to unplug medical treatments. Maybe some Asian American patients would not be able to tolerate this, so you need to work this through. And again, what you really need here is a cultural sensitivity. So you may tell them something like, okay, I am aware that your culture teaches you this, but our culture is different, so let's try to work out an agreement and so on. And very much as Hispanic Americans, Asian Americans also are strong believers in folk remedies. So this is something, again, that you need to work through. And lastly, Native Americans. They also have some rather particular cultural traits. So they have a strong belief in witchcraft. So if a patient comes in, there is some possibility that they may tell you that they're feeling bad. Not because they have an infection or because they have some disease, but because their neighbor did some witchcraft on them. And I have visited Native American reservations in California. I was in one of them, And I met some people that actually, yes, they do believe this stuff. So, the doctor needs to cope with this. For them, it's not clear that there is a distinction between physical and mental illnesses. So for them, feeling some pain in the stomach, it's not just a physiological process. It may also be related, according to them, to their status of mind. So, you need to work through this, and in order to do this, you need to develop some cultural sensitivity. So you should know what to expect when you treat a Native American patient, so that the more you know their culture, the more you're able to compenetrate with them and to work through the issues, understanding their culture from within. And Native Americans have a high risk of alcoholism, so this is something that you should always keep in mind when treating Native American patients. Okay, that's our last point, so let's do a couple of USMLE questions, which are questions that resemble the ones that appear in the USMLE. So let's begin with the first one. A physician has two 56-year-old male patients. One of them is African American and one of them is Caucasian or white. So statistically, the African American patient has a lower likelihood of A, stroke, B, asthma, C, hypertension, D, suicide, or E, prostate cancer. Well, in the case of the African American, the correct answer here would be D, suicide. African Americans are at increased risks in all those diseases, stroke, asthma, hypertension, and prostate cancer. But when it comes to suicide, white people kill themselves more than black people. And that may be due to the fact that African Americans are more oriented toward relatives and communities. White Americans tend to be more individualistic, and suicide is more related to loneliness and to detachment from other groups. So black people are better integrated to their communities, and that prevents them from committing more suicide. But when it comes to other diseases, they are at higher risk. And that's for a number of reasons. That could be due to lower access to healthcare, but also to some other cultural habits regarding feeding or nutrition and so on. Okay, let's consider another USMLE step 1 question. Which of these patients is most likely to spend the last years of her life in a nursing home if she becomes incapacitated? A, an 80-year-old Anglo-American woman. B, an 80-year-old Puerto Rican American woman. C, an 80-year-old Japanese American woman. D, an 80-year-old Mexican American woman. Or E, an 80-year-old Vietnamese American woman. Well, I think the right answer here is A, an 80-year-old Anglo-American woman. Remember that in as much as it's probably the most individualistic culture out of all those cultures that are mentioned there, Anglo-American people or white people in America, especially if they're from the middle class, they tend to be more oriented towards individualism. So they don't pay so much attention to caring for the elderly, because they're very oriented towards individualism and self-reliance. So they're the ones that are most likely to be left in a nursing home to be taken care of by professionals than the other groups. In the other groups, there is a much greater expectation that the family should take care of elderly people. And out of all those groups, I would say that the Japanese and maybe the Vietnamese are the ones who are more likely to take care of the elderly and not take them to a nursing home.
Okay, so today we'll continue with our 10th lecture from the behavioral science course. So far, we have covered mostly philosophical and psychological topics. We talked about philosophy in ethics, and we have covered grounds in psychology when it comes to developmental psychology, some basic psychological theories when it comes to learning, and also some psychological tests. Today we're going to delve into a new behavioral science, which is sociology, and how it relates to U.S. physicians. So today we will cover family, culture, and illness. So psychology is the study of mostly individual behavior, whereas sociology is the study of societies. Now the difference between psychology and sociology may not be all that clear, because there's also what's called social psychology, and that is how people behave when they're in groups. So it's sort of the middle ground between psychology and sociology. But today we'll discuss how family, culture, and illness relates to the medical profession. You as doctors have to understand that there are various cultural and social differences according to the patients and the groups they belong to. And you have to be ready to encounter different cultural and social groups, and also how they relate to their family. And maybe their way of organizing families is different from what you're used to. But this is crucial for someone. The greater the genetic similarity will be, or the greater proportion of genes there will be. And this is the basis of nepotism. Nepotism is the tendency that we all have to favor people with whom we are related. Now, of course, you may tell me that there have been people who are very altruistic towards others and they're not related to them. And well, it's because altruism is, according to evolutionary psychologists, is not just about kin selection. It could also be with the expectation of reciprocity. So we're good to other people, expecting other people to be good to us. But even aside from that, it could also be that adoption, to a certain extent, substitutes blood relations. Now, it has been documented by many evolutionary psychologists that adoption solidarity is never as strong as a real blood solidarity. So there is a tendency for parents to love their kids or to care more for their kids if they're related to them by blood than if they are adopted. And in evolutionary psychology, there is a phenomenon that I think physicians should be aware of, and that's called the Cinderella effect. We've talked about this in the past, and that is that there is a greater chance of child abuse if the child is adopted than if he's actually living with his biological parents. Well, that may have to do again with the fact that being related to other people increases our probability of now, evolutionary psychologists have a lot of discussion about whether or not blood bonds between people are stronger than other types of bonds. So, as you've probably seen in movies or read in books or seen many cultural depictions, people have always wondered whether or not blood is thicker than water. Now, of course, this is a metaphor. I mean, we're not talking here about the chemical properties of those two substances, but we're actually talking about whether or not those people that are related to blood tend to have stronger bonds amongst them. And evolutionary psychologists have told us for many years that yes, that blood is indeed thicker than water. And this goes back to a very important concept in evolutionary psychology that's called kin selection. Now, in kin selection, organisms behave altruistic towards those other organisms with whom they share some proportion of genes. Because in evolutionary theory, altruism has always been a little bit of a mystery. I mean, if we're in a struggle for existence, as Darwin claimed, then how come that some animals sacrifice themselves or behave altruistic for the sake of others? Well, it all makes sense if and only if, according to evolutionary psychologists, those organisms that are receiving our altruistic behavior are also related to us. Because by doing so, we make sure that they are able to, because in the medical profession, remember that many of these topics are about the doctor-patient relationship. I mean, how do you make sure that the patient complies? And in order to do all of this, well, you have to make sure that you build a strong doctor-patient relationship. And most of the time, the patient's relatives will probably be your allies when it comes to this. So you have to make sure that you understand, what are the basic sociological approaches to family life and also to culture. I mean, if a patient is from a different culture as the doctor, then there may be some adjustments that are necessary to make. So we'll cover some of those topics over here in this lecture. Remember that all of these topics are to be included in the USMLE Step 1. So at the end of this lecture, we'll do some review questions covering the topics that we talked about in this lecture. Okay, so let's begin with the first topic, and that is family. Well, how do we find a family? A family is a group of people that are related by blood, adoption, or marriage. So there are different types of family, and we'll get to them shortly. But for now, it suffices to know that, well, a family is a group of people related by blood, adoption, or marriage. So just because some people come together, like let's say a fraternity, well, a fraternity is not strictly a family, although it may come to that because the only, not necessarily being related by blood is the only way of forming a family. To pass their genes to the next generation by, sacrificing ourselves for them to live. And if they're able to pass their genes to the next generation, then that increases the probability that that very altruistic gene is also passed to the next generation. Now, that preference to favor or to be altruistic towards people that are related to us genetically, that in evolutionary psychology is called kin selection. And there was a very famous evolutionary psychologist, or actually he wasn't really an evolutionary psychologist, he was a biologist. His name was William Hamilton, who formulated some mathematical formulas explaining in mathematical terms how exactly kin selection works. Now, we won't get into that, but for now, it suffices to know that the kin selection is a very important concept in evolutionary psychology, and that it attempts to explain behavior, and I think it explains behavior pretty well, and that there is a tendency amongst human beings, and not only amongst human beings, amongst all organisms, but especially in animals, to behave altruistically to people who share, with whom we share genes. So you can expect someone to be more kind to their brothers, and to be more kind to their brothers than to their cousins, but at the same time to be more kind to their cousins than to their neighbors, and at the same time to be more kind to their neighbors than to complete strangers. Because the odds are that the more altruistic you are